Now that Margaret has checked in, you'll move to the clinical side of McKesson Practice Choice and document today's encounter. You'll notice that your work list appears again on the left-hand side. Here are your appointments for today, which you may filter to show only those patients who are ready to see the physician. This allows you to easily review, finish, and sign notes from the staff members you supervise, and to access any notes you've started but not finished. The third tab is our clinical tasks. Lab results are included in McKesson Practice Choice, and these inbound results will automatically populate in the patient's chart and in the work list. Now, with a single click, you'll open Margaret's chart. Up at the top of the chart, you have a banner with the patient's demographic information as well as any allergies. Directly underneath is the Chart tab, which allows for intuitive navigation of the patient chart. And over here is the encounter detail and progress notes section, which will be covered later. Here in the Patient Summary tab, you'll notice a timeline of patient visits. Hover over one for more information. This one screen allows you to get a summary of this patient's previous encounters in a single glance. If you would like additional information on any item on this screen, simply navigate to that section of the chart. First, your nurse will review Margaret's history. This tab contains the past medical, family, and social history sections. Anything you update in these sections can be pulled into the progress note. The red text denotes a pick list. By clicking on the pick list, you'll see a list of options, and you can select one or multiple items from the list. You will see these pick lists again in the progress note. Next, you'll move to the Vitals tab. Let's say you want to graph the last 5 vitals. McKesson Practice Choice has a number of preset graphs, or you can choose the vitals you'd like to plot on the graph. Let's take a look at how Margaret's weight is affecting her blood pressure. This graph can help Margaret connect to the need for behavioral modification, medication adherence, or procedures. Perhaps you want to take a quick glance at the document library before starting your progress note. The Document Library tab is where you can scan and upload items directly into the system. This tab is especially useful for the offices that are coming from paper, and those offices that receive high volumes of faxes and paper items. As you can see, you have the ability to filter the items based on the type of document you're looking for. Now that you've updated the history, taken and charted vitals, and reviewed the clinical note, you are ready to start documenting in the Progress Note section.